Hi, this is David Villar, and welcome to this presentation that will address therapies for one of the most common reasons why dogs and cats are taken to the veterinarian. Just like it happens to any of us, dogs and cats are going to develop diarrhea episodes in their lives at some point in time. We're going to see it sooner or later, and it's just a matter of time when and where it will happen. And there are just as many possible therapies as reasons why pets develop diarrhea. And this is evident when we look at the huge number of diets that are now available to treat gastrointestinal problems. And the same can be said for probiotic medications that are indicated to replace the normal gut microflora. So, as you can imagine, finding the actual source of the animal's problem and getting to the bottom of what's truly going on is going to be the best guide to decide what we need to do on each situation. So if in the previous video we talk about the different approaches to make a diagnosis, here we're going to focus on the treatment for the most common causes of the diarrhea. And because of the source of the diarrhea could always be an infectious organism that could be potentially transmissible to people, any dog or cat with diarrhea should always be suspect of having a zoonotic disease until proven otherwise. We have probably all heard of salmonellosis, and that's just one type of bacterial infection that is transmitted from animals to humans. And what we don't usually think of is that we can also pass on our infections to our pets. So, good personal hygiene habits go a long way to prevent that transmission from ever taking place. Diarrhea is one of those conditions that has always been treated empirically without real evidence of what we're truly treating for. And there is probably one of those conditions for which there are more treatment protocols that lack medical support than many other. And for example, based on absolutely nothing, the bowel needs to rest to restore its normal function. So the practice of withholding food for even 24 hours may actually be worse because the rapid turnover of that mucosal epithelium usually needs a very constant supply of nutrients that come from food. And this has been proven, particularly so in scouring baby calves, and it's no longer recommended to withhold milk that provides all the essential nutrients and calories that a sick calf requires to get back to normal. So unless the animal has severe vomiting, it may not be wise to upset the animal even further by fasting. And now another misconception is considering a highly digestible diet as a bland diet. Chicken and rice only are deficient on many things. Highly digestible diet is usually one that we tend to reach for cases of acute enteritis, and they don't usually require the action of bile and pancreatic secretions. For example, they replace long fatty acids by medium chain fatty acids. They also have antioxidants and omega fatty acids, and they usually tend to provide all the essential nutrients. So if you plan on using a bland diet, just remember that it should probably be done for no more than a few days. As we will discuss later, most veterinarians prescribe antibiotics for dogs with acute diarrhea. And this is really alarming because they should not really be considered as a first line of therapy. And probably nutritional management, deworming, probiotics, and maybe some antidiarrheal agents is probably all that we need for acute cases. Now, another old wives' tale is considering chicken as a hypoallergic diet. It may not have as many allergens as beef or dairy products, but it still may cause food sensitivity. And finally, there is recent evidence showing that probiotics have pretty convincing effects restoring the gut microflora and helping that animal getting off the toilet, so to speak. However, as we will see, there are many over-the-counter products that have very little oversight, no real quality control studies. So unless the claims are supported with research, you probably want to stay away from some of those generic names. So again, the principles of therapy should follow a complete workup. So we design the treatment to match the right condition that causes the diarrhea. And as we will see, these can be quite challenging, particularly in cases of chronic diarrhea. So even though they're the things that may cause acute and chronic diarrhea, may sometimes overlap. The therapeutic plan initially is usually for each one is going to be different. And in many occasions, we're going to reach a diagnosis by exclusion and response to different therapeutic trials. So we're going to begin with this beagle, which has had diarrhea for at least 3 or more weeks. And if we take a look at this diagram, the majority of chronic cases will have an origin within the intestines, and they could be either inflammatory, infectious, or neoplasias in that order. We're going to discuss the most common ones, which are the inflammatory and infectious situations, in more detail on the next few slides. But just keep in mind that there are other differentials like lymphoma, which is probably the most common type of neoplasia, and fortunately it responds better than other types of neoplasias to chemotherapy protocols. And there are also diseases that are outside of the GI that will also cause chronic diarrhea. The most common one in this category is pancreatic insufficiency, which usually responds well to oral treatment with enzymes. And in this secondary group, you obviously need to treat the underlying disease first if you expect that diarrhea to go away. And we could also include things like diabetes, hyperthyroidism, adrenal insufficiency. But as I say, probably the most common one is going to be pancreatic insufficiency. So if we focus on the most common causes of chronic disease, the number one falls into different types of inflammatory conditions. And within this group, the most frequent one is food responsive enteropathy in about 60% of those cases. The way to diagnose this type is by doing an exclusion or elimination diet, in which we basically replace the original diet by either a novel or a hydrolyzed diet. With novel, we mean something that has not been fed previously and hopefully will not have the offending component of that original diet. And if it is a diet responsive condition, most animals will get better in about 1 to 2 weeks, which, as you can see, is much shorter than for allergic skin disorders that may take up to 6 to 8 weeks to respond. When we talk about the hydrolyzed diet, those are the ones that the proteins have been broken down into small peptides of about 6 to 15 kilodalton, which is below the radar screen that will be picked up by the immune system as foreign antigens. Now, the other less common types of inflammatory enteropathies are the antibiotic responsive and the immunosuppressant responsive. The first one is unclear because there is no single bacteria that has been identified, and the speculation is that the syndrome is caused by an overgrowth of many different type of bacteria. And the animals usually tend to respond well to metronidazole or tylosin for a course of 1 to 2 weeks. And finally, if a therapeutic trial with food and antibiotics do not resolve the situation, the next step is usually a protocol with prednisone for several weeks. And sometimes, to avoid the side effects of corticosteroids, you can try cyclosporine, which has been shown to work pretty well for those cases that are immunosuppressant responsive. So as you can see, in all these cases of inflammatory bowel disease, the cause of the enteropathy will be an exclusion diagnosis in which you basically systematically go one step at a time, ruling out the different possibilities that may underline the problem. And just remember that there are also a genetic predisposition in certain breeds, like the German Shepherds. And there is research showing that there are certain mutations of proteins in the immune system, like the toll-like receptors, that make these particular breeds more susceptible. So if you were to have a dog that comes into the clinic with chronic diarrhea, it may be worth looking if there is a genetic predisposition on that particular breed. So this is kind of the roadmap that can be followed to diagnose cases of chronic diarrhea. And for some causes, there may be a specific test that can be used, particularly for the secondary causes of diarrhea. But if I were to ask you, what important category are we missing here in this diagram? What would you say? Well, you notice the parasitic ones tend to fall within the infectious categories. And within this group, we have the whipworms, the roundworms, and the unicellular bugs. And because fecal testing is relatively simple to do, it should always be part of a diagnostic workup to rule out these parasitic infections. And the classical drug to deal with the big ones is usually fenbendazole for about 5 days. For giardia, you can go with metronidazole, which is usually the first line of therapy. But you can try fenbendazole that also targets this organism. So if you were to have, for example, a co-infection with roundworms and giardia, that would probably be the drug of choice. For Cryptosporidium, the drug of choice appears to be azithromycin. For Trichomonas, you can go with either metronidazole, or it's been shown that sometimes they only respond to ronidazole. And for Coccidia, we have either metronidazole or diarrheal, which is the active ingredient of Baycox. So as I mentioned at the beginning of the presentation, there are a lot of different commercial diets that should be part of protocols for GI conditions. And this is really a topic that there is an overwhelming amount of research and development. So here I'm just going to say a little bit about the different types of diets that are now available. And we're going to break it down for cases of chronic diarrhea, and then we'll see the ones for acute diarrhea. Now, until we have a definitive diagnosis, you can try changing the diet in cases of a small bowel diarrhea and hoping that it may be a food-responsive enteropathy. We have already mentioned the hydrolyzed and the novel diets. Now, when the diarrhea originates from the large bowel, we can try with a diet containing high fibers, ideally a mixture of soluble and insoluble fibers. Fibers are basically made up of complex carbohydrates, which cannot be broken down by mammalian enzymes. For example, they contain cellulose, which, as you know, makes up the plant cell walls. And in that respect, they are obviously not essential for dogs and cats. And because they can bind nutrients and reduce their absorption, the downside is that the animal may not get enough calories and will need to eat more. Now, the reason why they can be beneficial in cases of colitis is because some of those sugars will ferment in the colon and produce small chain fatty acids like butyric acid, which is a good nutrient for colonocytes. And by also lowering the pH of the colon, they also increase the amount of the good bacteria and tend to decrease the ones that may cause diarrhea, like Clostridium. And the other effect of fiber is that it tends to normalize the transit time by changing the motility. So in cases of diarrhea, they may prolong transit time. And if you were to have a constipation, it may do the opposite. That is shortening the transit time. It'll probably do so by increasing the fecal bulk, which tends to stimulate defecation. So when we refer to prebiotics, fibers would be one type because it favors the proliferation of the good bacteria in the colon. And if we say a few things about probiotics, there is new evidence suggesting that it should probably be part of most protocols to manage GI problems. There is very convincing effects that they tend to lessen the duration of diarrhea in many situations, whether this is an acute or a chronic or a large or a small bowel diarrhea. Probiotics are basically a culture of live good bugs that are supposed to outcompete or suppress the bad guys in the intestines. And they also seem to enhance or stimulate the local immune system. I will not really say much more about probiotics here, except that there are many different ones on the market with no quality control studies to support that they actually have any clinical benefit. So you may want to check what has been done to prove that they actually work and they meet the label claims. And on this study in the Canadian Veterinary Journal, They found that only 4 out of 15 products on the market that had specific claims of viable organisms, only 4 of those 15 met or exceeded the label claims. So this is something that you just may want to keep in mind if you're going to decide to choose probiotics. So let's say a few things about treatment for acute cases of diarrhea. Most of the times, acute cases are going to be self-limiting, and whenever the thing that causes it runs its course, they tend to resolve. So in this case, the situation of the idea of the treatment in most times is going to help that diarrhea go away faster. The first two motility modifiers are loperamide and difenoxylate. These two tend to increase those segmental contractions, and that by constricting the size of the lumen, basically they slow the movement of feces along the GI. And what happens in many cases of diarrhea is that the bowel loses its smooth muscle tone, but the decrease on those segmental contractions is greater than the peristaltic contractions, and that explains the increased movement of feces and defecations that we're going to see in diarrhea. Now, the anti-secretory effect of these two narcotic drugs may actually be more important in slowing the movement of feces through the gut. With regards to the anticholinergics, these may have a role when we have spastic contractions, for example, when you see an animal with tenesmus or crampil rectal pain. If we talk about the anti-inflammatory drugs, they work by preventing the formation of prostaglandins, which is actually a way of counteracting the action of many bacterial toxins. Without those prostaglandins, there is going to be less secretion of fluid in the intestines. And apart from the anti-inflammatory actions, with some of them like Pepto-Bismol, there appears to be a protective effect by coating or shielding the mucosa from those bacterial toxins. And you've probably all taken kaopectate at some point in time. The funny thing is that there are no really good control studies proving that it actually works. Theoretically, it's a type of clay that binds toxins, and this way it may decrease the secretion of fluid into the GI. Now, what's definitely a good magnet or absorbent for those bacterial enterotoxins is activated charcoal, which is also known as the universal antidote because it will bind many other potential poisons and prevent them from absorbing and getting into the bloodstream. The downside with activated charcoal is that it tends to be messy to administer, and that may deter some people from using it. Well, before I finish, I wanted to point out this study that was done among British veterinarians in their habits for dogs with acute diarrhea. The results show that 71% of 371 dogs got antibiotics to treat acute diarrhea. And if we read the conclusion of the study at the bottom, the frequent use of antibacterial for acute diarrhea is surprising and somewhat alarming. There is evidence that resistance to antimicrobials is increasing among bacteria isolated from pets. Nutritional management, therapeutic deworming, and probiotic therapy, accompanied in some cases by antidiarrheal agents, should be considered the first line of therapy. So just to remember that for acute cases, antibiotics should not be the first thing that comes to mind, and you may want to try this other alternative first. It was not mentioned here, and I didn't really say anything about it, but if the acute cases were to be caused by parvovirus, that would be a game changer. In those cases, you definitely want to use antibiotics because the animal usually dies from a septicemic shock. So this was my final slide. I hope it was worth your time. There were many things covered, and I know most of them require more in-depth analysis. But the idea was to give you a quick overview that may help you design your own therapeutic plan for diarrhea. So until next time, bye-bye for now.